Let's discuss interviewing worry. Worry is one of the most common emotional causes of disease in our society. The extremely rapid and radical social changes that have occurred in Western societies in the past decades have created a climate of insecurity and anxiety in all spheres of life. Of course, there are also people who, because of pre-existing disharmony of the internal organs, are very prone to worry, even about very minor incidents in life. For example, many people appear to be very tense and worry a lot. On close interrogation about their work and family life, often nothing of note emerges. They simply worry excessively about trivial everyday activities and tend to do everything in a hurry and be pressed for time. This may be due to a constitutional weakness of the spleen, heart, or lungs, or a combination of these. Worry nuts qi, which means it causes stagnation of qi, and it affects both the lungs and the spleen. The lungs because one is worried, breathing is shallow, and the spleen because this organ is responsible for thinking and ideas. Worry is the pathological counterpart of the spleen's mental activity in generating ideas. In a few cases, worry also may affect the liver as a result of the stagnation of the lungs and a five-element sense that corresponds to metal in salting wood. When this happens, the neck and the shoulders will tense up and become stiff and painful. The symptoms and signs caused by worry will vary according to whether they affect the lungs or the spleen. If worry affects the lungs, it will cause an uncomfortable feeling in the chest, slight breathlessness, anxiety, tensing of the shoulders, sometimes a dry cough, and a pale complexion. The right front pulse position of the lungs may feel slightly tight or wiry, indicating the nodding action of worry on qi. If worry affects the spleen, it may cause poor appetite, a slight epigastric discomfort, some abdominal pain and distension, tiredness, and a pale complexion. The right middle pulse position, the spleen, will feel slightly tight but weak. If worry affects the stomach as well, which happens if one worries at meal times, the right middle pulse may be weak floating. Worry, it affects the lungs, heart, and spleen. It nuts qi. It may also affect the liver. It affects breathing and the corporeal soul. Thank you for your attention.
Let's talk about the Han Yang Min, the large intestine meridian. Li 20, Yin Xiang, welcome fragrance. Here in this table, we see the Han Yang Min large intestine meridian, where it starts from the tip of the finger onto the face at Li 20. Li 20, Yin Xiang, or welcome fragrance. This is the surging yang, thoroughfare yang receiving fragrance. The exit point and the meeting point of stomach and large intestine. This point clears the nose, helping the person to receive and inhale, breathe, and life. Inhale, breath, and life. It lifts the mind and spirit to a new state, a reminder that the controller of the drainage of the dregs are responsible for change and evolution. This welcoming of life, this receiving fragrance, is equally necessary at the level of the mind and spirit as it is at the physical level. There is circulatory in the necessity of each stage of life being received, differentiated, processed, and let go, and this point, which revitalizes the capacity to inhale, will in turn enhance all these phases. When healthy, we welcome not only fragrance, but new involvement with life. Odors are often the most potent sense of memory, linking us to our past momentarily. Although the sense of smell has diminished as humans have developed, It is such a primal instinct and very appropriate to be associated with the po or animal soul. Welcome fragrance is the exit point of the large intestine and meets with the stomach meridian. The fragrance referred to in its name reminds us not only of its physical capacity, but its connection with the earth element and the associated fragrant odor, and that large intestine and stomach together are the yang ming. As the last point on the large intestine, the name of this point suggests that letting go, the end of one process, allows you to welcome in something new. Dispels exterior wind cold or wind heat when there is sneezing and stuffy runny nose. The large intestine meridian has a major effect on the face. LI20 is often used as a local point for face pain, often in conjunction with a distal LI point or with a stomach point as part of Yang Ming. As it dispels exterior wind, it can also be used for facial paralysis, tic, and trigeminal neuralgia. Opens the nasal passages. Local point for nose problems, sneezing, loss of smell, sinusitis, runny or stuffy nose, allergic rhinitis, and nasal polyps. The indications are it invigorates the body, mind, and spirit, local problems of the nose, tic, and facial paralysis. This point can resolve or enhance a patient's diminishing sense of smell. It is said to work on a higher level too, welcoming in new experiences, whilst enabling a person to recall old ones without living in the past. For sinusitis, hay fever, or rhinitis. Consider for facial paralysis, trigeminal neuralgia, eye disorders, or digestive problems because it connects to the stomach. Thank you for your attention.
Let's discuss small intestine pattern, excess heat in the small intestine. Concept. This pattern results from exuberant heat in the small intestine. Clinical manifestations, heart fixation, where there is irritability, there's insomnia, thirst with desire for cold drinks, tongue and mouth ulcers, dark and scanty urine, burning pain on urination, hematuria, there is presence of blood in the urine, there's red tongue with a yellow coating and a rapid pulse. Analysis, this pattern is caused by heat in the heart shifting to the small intestine. Key symptoms, symptoms of exuberant heart fire, accompanied by dark and scanty urine and burn. So here the analysis of excess heat in the small intestine. Heat in the heart shifts to the small intestine. There is dark and scanty urine, painful urination. Exuberant heat injures the network. There is hematuria. If there is exuberant heart fire disturbing the mind, there is heart fixation and insomnia. If there is heat steams the body fluid, there's thirst. Exuberant heart fire blazes upward. The tongue and mouth, there's tongue and mouth ulcers. Red tongue with yellow coating and a rapid pulse are the manifestation of interior heat. Summary, full heat in the small intestine, etiology, emotional problems, prolonged anxiety, stress, anger, depression, always on the go, excessive mental activity. Underlying accompanying pathology, there's stagnation of liver chi stagnation in the lung, heart chi stagnation, heart fire blazing, damp heat in the bladder. Possible presenting conditions, urinary tract infection. For the signs and symptoms, there is mental restlessness, tinnitus, sore throat, tongue ulcers, discomfort and heat in the chest, abdominal pain, thirst, scanty and dark urine, painful urination, blood in urine. Pulse, there is rapid and overflowing, especially in the front left position. The tongue is red with red and swollen tip, yellow coating. For the treatment principle, we have to clear the heart and drain fire in the small intestine, stop abdominal pain, calm the shen, supplement yin to clear heat. For the acupuncture treatment, we use small intestine 2, clears small intestine heat, SI3 clears interior heat, spleen 9 clears heat from the lower burner, heart 5 clears heart fire, stomach 39 lower C point for small intestine, which stops abdominal pain, SI5 clears heat and calms the mind, REN 3 this inhibits the bladder, REN 4 regulates chi in the lower burner, heart 8 clears heart fire. So we needle with drainage. Relevant advice: food and beverages that have a hot energy should be avoided. Thank you for your attention.
Let's talk about pulse taking, abnormal rhythm, a hurried pulse, racing, urgent, swift, or G-money. Hurried pulse. This is an overall rapid pulse with irregular intervals of missing beats. Clinical significance. The hurried pulse is seen in two major types of illnesses. In one, yang heat is strong. In the other, the Zangfu viscera are insufficient. A hurried pulse that is forceful suggests strong yang heat and barricading of the pathogenic evil. A hurried pulse that is feeble suggests insufficiency and decline of the visceral organs. The hurried pulse is rapid by definition, beating at least 8 times for each breath cycle, and it gives the impression of being hurried, anxious, agitated, and urgent. The analysis: when yang heat is strong, blood circulation faster. Hence, the pulse is rapid. However, because of stagnation of qi, blood, phlegm, and food impeding blood flow, there are intervals during which there is no pulsation. In insufficiency and decline of the viscera, yang qi dissipates to the exterior, so that yin and yang no longer succeed each other. Because of this, the pulse is also rapid with intervals without pulsation, but in addition, the pulse is feeble. In this table, we see the indications, the pathogens, the pathogenesis, and the remarks. So if it's racing and forceful, there's racing and forcefulness, racing and forceful, hyperactivity of yang and excessive heat, and yin exhaustion and anti-pathogenic qi collapse. The biomedicine is hypertensive cardiopathy, coronary heart disease, hyperthyroidism, myocarditis, pericarditis, auriculoflutter accompanied with regular 2-to-1 atrioventricular block or functional tachycardia. Yin exhaustion with hyperactivity of yang or excessive pathogenic heat causes acceleration of the blood flow and a high pulse rate. This is a critical pulse. However, this pulse rate is considered normal for the healthy infant. The hurried pulse generally indicates severe deficiency of yin with intense empty heat. It always indicates a serious condition. Hurried pulse, the summary of clinical significance is deficiency of yin with empty heat and severe rebellious qi of the penetrating vessel. Thank you for your attention.
Let's discuss stagnation of cold in the liver channel. The yin channels in the legs are vulnerable to invasions of dampness and cold, and this imbalance will often arise when the person has been wearing too little or wet clothing on the legs and feet. The condition will usually be acute. Etiology: invasions by exogenous pathogenic qi. Symptoms and signs: distension, tightness or pain in the groin or around the bladder, pain or shrinkage of the genitalia, distension, tightness or pain in the area above the pubic bone in the hypochondriac region, pain that is ameliorated by heat, aversion to cold, cold hands and feet, headache at the vertex, nausea, explosive watery vomiting, wet and white tongue coating, slow, deep, and confined or tight pulse, especially in the left quan and sure positions. Key symptoms, pain above the pubic bone and around the genitals, aversion to cold, wiry, and slow pulse. Treatment principle, expel cold and coarse qi in the liver channel. We choose from RAN 1, 2, 3, liver 1, 3, 5, and LI4. Needle technique is draining. Moxa is recommended. RAN 1, 2, and 3 drain dampness from the lower jaw and resolve stagnations of qi in and around the genitals. Liver 1, 3, and 5 circulate qi in the liver channel. LI4 expels cold. Relevant advice: if the stagnation of cold in the liver channel is a chronic or recurring pattern, the person must make sure that they wear adequate and appropriate clothing and footwear. They should avoid exposure to the cold and damp. Stagnation of cold in the liver channel can be caused by invasion of exogenous pathogenic qi, liver qi stagnation, and can result in qi stagnation in the lower jaw, blood stagnation in the lower jaw. Let's summarize stagnation of cold in the liver channel. Etiology, invasion of exterior cold. Underlying accompanying pathology, invasion of the liver channel by cold. Signs and symptoms, fullness and distension of hypogastrium with pain, which refers downwards to the scrotum and testes and upwards to the hypochondrium. Alleviation of pain by warmth, straining of the testes or contraction of the scrotum. Bright white complexion, green, blue, or purple lips, vertex headache, a feeling of cold, cold hands and feet, vomiting of clear watery fluid, copious clear urine, loose stools. In women, there can be shrinking of the vagina. Pulse, deep, wiry, slow. Tongue, pale and wet with a glossy white coating. Treatment principle, warm the liver and dissipate cold, rectify qi and stop pain. Acupuncture treatment, RAN 4, to scatter cold in the genitals. RAN 6 to warm the lower burner, Spleen 6 to warm the liver, nourish blood, RAN 3 scatter cold from the lower burner, liver 5 to scatter cold from the liver channel, liver 1 to clear the liver channel, and liver 3 to course the liver qi. We needle with drainage. Moxa can be used in large amounts if there are significant cold signs. Thank you for your attention.
Today, let's talk about skin inspection, papular rash. A papular rash. A papule is characteristically red in color, raised above the skin surface, millet-shaped and easily felt. A papular rash may be seen in many illnesses. The most common are as follows. 1. Measles. This is a common and acute childhood contagious illness. It is caused mostly by a seasonal pathogenic agent which enters the body through the mouth and the nose and attacks the lung and the stomach. It is common during winter and spring. And that is the illustration of the measles. The rash of measles is typically in the form of rose-colored papules that blanch on pressure. The individual papules may form patches, but normal skin is visible in the patches between papules. The rash begins behind the earlobes and at the hair margins, gradually extending to the forehead, the neck, and the trunk, and finally the limbs. The progression of the rash is complete in 3 to 4 days. After the rash clears, there usually is desquamation and hyperpigmentation. Inspection of the rash of measles should emphasize its color and appearance and the distribution of the papules. This information should be correlated with information about the other symptoms in order to assess the degree of severity and the prognosis of the illness. Thus, if the papules are red and moist, are evenly distributed, the rash advances and recedes in proper order, and the fever subsides as the rash fades. Then the pathogenic evil is dissipating and the illness is mild with good prognosis. Conversely, if the papules are dark purple, densely distributed or coalesced into large patches before complete eruption, or they suddenly fade and are associated with high fever and labored breathing, then the illness is severe and has a poor prognosis. Number 2, rubella. This is an acute contagious illness caused by seasonal wind-cold pathogenic evil. It mostly affects children between 6 months and 5 years of age, and is most common during winter and spring. The papules of this rash are typically light red and are smaller than those of measles. They are sparse, mostly on the face and neck, do not coalesce, and are often itchy. The eruption is generally complete within a day and fades in 2 to 4 days. After the rash clears, there is no desquamation or hyperpigmentation. That is the illustration of the rubella. Number 3, urticaria. This rash is usually due to disharmony between qi and blood, disturbed nutritive and defensive qi, or exogenous wind cold or wind heat expressed in the skin. In addition, inappropriate diet or emotional upheaval can also cause it. The characteristic lesions of urticaria are nodules in the skin, both small and large. They range in size from sesame seeds to broad beans. In severe cases, there may be giant masses or patches. The rash is red, light red, or white and intensely itchy. The lesions may come abruptly and vanish. If the urticaria is light red or white, the tongue coating is white and the pulse is tight. It is due to wind cold. If it is recurrent or chronic, it is due to deficiency of both qi and blood. And that is the illustration of urticaria. Thank you for your attention. Now let's talk about the epigastric pain, the Western differential diagnosis 2. Duodenum, or the duodenal ulcer. This is characterized by ulceration of the duodenums associated with increased secretion of acid. The pain starts in the center of the epigastrium and comes in bouts. It usually starts 2 or 3 hours after eating, and it is relieved by eating little and frequently. Other symptoms are similar to those of gastric ulcer. Pancreas, pancreatitis. Pancreatitis is inflammation in the pancreas. It can occur as acute pancreatitis. It appears suddenly and lasts for days, or chronic. It occurs over many years. Pancreatitis occurs when digestive enzymes become activated while still in the pancreas, irritating the cells of the organ and causing inflammation. In severe forms, this inflammatory cascade is responsible for the systematic manifestations of the disease. In the majority of cases, alcohol abuse and gallstones cause pancreatitis. Patients with acute pancreatitis frequently feel severe and constant pain in the upper abdomen, and which crosses the body's midline and radiates to the back. It is often associated with vomiting. Pain reaches a maximum intensity quickly and can last a long time. The patients may present with various systematic manifestations. The general symptoms include tachypnea, rapid shallow breathing, hypotension or low blood pressure, tachycardia, fever with signs of shock, multi-system organ failure, and the altered state of consciousness. The differentials for pancreatitis include peptic ulcer disease, biliary colic, cholecystitis, bowel obstruction, mesenteric ischemia, and diabetic ketoacidosis. Carcinoma of the pancreas. Early pancreatic cancers often do not cause any signs or symptoms. By the time they cause symptoms, they have often already spread outside the pancreas. When reported, the symptoms are rather vague and do not indicate a specific disease. Thus, the potential for misinterpretation is high. Symptoms include weight loss and poor appetite. Jaundice means yellowing of the eyes and skin, pain in the upper abdomen or back, weakness, nausea, and vomiting. Large intestine, appendicitis. In a few cases, appendicitis may start with epigastric pain. However, it soon extends to the lower abdomen or umbilical area. Irritable bowel. More than a proper diagnosis, this term tends to be a catch-all for all cases of abdominal pain that do not have another explanation. However, it is important to remember that in approximately 42% of cases, irritable bowel may present with epigastric pain. However, it is equally important to bear in mind that from the perspective of Chinese diagnosis, if the pain is in the epigastric region, it definitely indicates a stomach pathology. And in any case, the stomach is closely related to the large intestine within the bright yang. Gallbladder, gallstones. Gallstones are the acute clinical manifestation of cholelithiasis, presence of concretions that form in the biliary tract. If a gallstone lodges in a duct and causes a blockage, the resulting symptoms include sudden and rapidly intensifying epigastric pain radiating to the right hypochondrium, back pain between the shoulder blades, pain in the right shoulder associated with vomiting. Pain from gallstones often occurs after eating and lasts 3 to 4 hours. Acute coronary syndrome, inferior wall myocardial infarction. Abdominal pain can be related to extra-abdominal causes, which must also be considered. Inferior wall myocardial infarction is characterized by epigastric pain, which can be confused with abdominal or stomach pain. It is usually very severe, sharp, or burning, often associated with cold sweating and feeling of impending death. Hypotension and bradycardia can be observed. Red flag in Western medicine. Particular attention should be paid in case of early, constant epigastric pain with or without breathing difficulty, hypotension, and sweating. In these situations, infarction must be ruled out. In any case, acute or chronic epigastric pain requires careful diagnosis and imaging evaluation because this condition may have many possible causes varying greatly in severity. Thank you for your attention.